Good evening, everyone. My name is Dr. Bruce Ettinger, and I'm the Executive Director of Spectrum360. And tonight we're going to be presenting the first presentation in a series of 4 on housing options for adults on the autism spectrum. And it will be featuring the attorney, Ms. Lisa Parles. Spectrum360, our mission is to provide the highest quality educational and therapeutic programs for children with learning, language, and social emotional challenges to achieve their maximum potential to become responsible adults in society, and to serve as a leader in promoting the following innovative educational programs. Our programs include Academy 360 Lower School and Academy 360 Upper School that serves children in age on the autism spectrum and with related disabilities from 3 to 21 years of age. Independence 360, which is approved by DDD and DVR, which serves adults over 21. We have a day habilitation program and a vocational program. Culinary Academy for high school students and for young adults, and we have a film academy. The reason why we're sponsoring this workshop is a result of our strategic planning and our promise to our families to enhance their knowledge of navigating the system and securing the most innovative options and best suited to meet the needs of their children in the future, requiring residential settings. As our high school, including our young adult program, continues to grow, and our adult program in Independent 360, the need for us to provide resources in the area of residential and knowledge is becoming more compelling. It's an increasing high priority to our families and to our organization. We are hopeful that the workshops that we will be conducting will continue on an ongoing basis, and an opportunity will be provided for families to share knowledge and ideas and to advocate for a broader range of housing options. I want to take this opportunity to especially commend our Public Information Officer, Melissa Cooper, and our consultant, Brenda Considine, for organizing these workshops and for identifying and securing the speakers and presenters that have so much expertise and knowledge. And I want to thank them all for agreeing to present pro bono. The theme of all our sessions is exploring housing options, but the main theme behind it is to go from an idea to innovation. I want to thank you, parents and people that have signed up, for your flexibility. Originally, we planned this as a live event, but COVID-19 has taught us to be flexible and resourceful and to be more innovative. I want to take an opportunity to commend the sponsors for these workshops, TD Bank and the Helen and Walter Mintz Research Fund, for funding this. The funds that we received and parents that have given donations will be put in a special fund to fund future such events in the area of housing, which I hope will be live. It's going to be a series of 4 workshops. Tonight's will be dealing with the housing crisis presented by Lisa Parles. And on September 22nd, we're going to have part 2, reviewing rules and regulations and financing. And we're very fortunate to have Diane Riley, who is the Executive Director of SHA, who will be presenting, along with Tom Taranto, who who has created such innovative housing across the country, for individuals on the autism spectrum. On September 29th, it'll be Innovation and Family-Driven Supportive Housing, from ideas to implementation. And we're going to have some directors that have helped develop very creative housing options. And I know a number of our families are using these housing options for their children. And then we're going to end on October 6th, where our fourth session will be another innovative housing model presented by a speaker from Next for Autism that has funded a very creative program. And also, a lot of our speakers were going to be back, including Lisa, to answer any questions that aren't answered during sessions. On Thursday, the recording of tonight's session will be emailed and will be posted on our website. And please share them with friends and family. And we invite your friends and family to come to upcoming webinars. All our sessions will be available on recordings. And please, any questions you have, please put them down through the Q&A chat room, and Lisa will be responding. All right, it's my great pleasure to introduce Lisa Parles. Lisa is a partner in the law firm of Parles and Reckham. In addition to her work helping families secure the service that they need for their sons and daughters, she's represented numerous not-for-profit organizations. She's a founding board member of the National Council on Severe Autism. She's appeared on Nightline and World News Tonight, and she's spoken before the United Nations about the rights of people with autism. Perhaps most importantly, she's spoken to hundreds of parent groups who need her expertise, advice, and her vision for a better future. She's been honored by Seton Hall University, ASA, Alpine Learning Group, Cablevision, Bergen County's 201 magazine, and the Community Health Law Project. She's the mother of an adult son with complex autism. Lisa's been working at the state and national level for flexibility in public policy that will allow greater choice for families. She's become the voice for choice in many policy discussions. On a personal level, I've been fortunate to know Lisa for many years, and thanks to her effort, I've seen many children and families that end up in our own school and in other programs, and adults get the services and programs they need because of Lisa's fierce advocacy, her caring, and her passion. Okay, it's my pleasure to introduce Lisa Parles.
Okay, Melissa and Bruce, can you hear me? Yes, great. Okay. So first of all, thank you for that lovely introduction, Bruce, I must say. And I would like to thank Spectrum360 for allowing me this opportunity to talk to you all tonight. It's really a wonderful program. I know Bruce has worked on it for some time. It's been an idea we've been talking about for some time because the need is so great. So I'm going to try to do a couple things tonight. The first is we're going to obviously do a presentation, leaving at least a half hour at the end for you all to ask some questions and answer them. As Bruce indicated, if we don't get to all of them, we will be back again on the last night of the presentation. So you will be able to ask additional questions as well then. You see from your speaker lineup, you have a number of really wonderful speakers coming in the coming weeks. And some of the topics I touch on, they'll go into in greater depth. depth, but I would like to spend a little time just running through some history and some terminology, because I think that's really, you know, important. I know that whenever we do these presentations, we frequently have a mixture in the audience. We have some parents of younger children that haven't experienced residential yet, families whose loved ones are already placed, and are either, you know, in the system, and even those that are just entering. So given that mix, I think it's always helpful to run through that. In terms of addressing the crisis, we all know that it's not just a New Jersey problem. It's been complicated by a number of factors. One being, of course, just the increase, particularly in autism. We know from not only national research, but research in New Jersey, that we have seen a you know, tremendous growth, or really a tsunami in the autism statistics. We, though not too long ago, nationally in 2000, it was 1 in 166. We're now currently 1 in 54, and in New Jersey, 1 in 32. Professor Zarodny from Rutgers Medical School translates it to 3% of children in New Jersey. So we have a tremendous need. We've also seen on the national level that there's an increasing percentage of those in the Medicaid system are actually coming from the autism community. So each year that percentage goes up. Now, looking outside of autism, just to the general IDD population, there's been some work done by a wonderful group, Madison House Autism Foundation. I'm going to talk a little bit later about the Coalition for Community Choice, but they've have some estimates that not even 10% of individuals that have need for housing and placement outside their family home have had their needs met. So we all know that it is, the need is great, and there have been some barriers, not just funding, but also some rules and regs, and actually really some confusion about the rules and regs. So I do want to tell you that we're going to end on a positive note tonight to tell you about some developments that I think really open the doors to some real innovation. So with that, Melissa, if you could advance the slide, I'd appreciate it. Okay, so I want to, as I said, do a little bit of terminology here. So when we're talking about housing, we always want to think about it both under 21 and over 21, but also not just the housing component, meaning the structure that we build, the program that we design, but also how the program is funded, right? So the meaning, when I say the program, I mean the services themselves, whether that is group home staff or self-directed employees in a home model, whether it's in a rental program or in the family home, that we you know, have to really think about it from both perspectives. So I'm going to run a little bit through just the various funding sources. For under 21, there's principally 3 funding streams. One is the school district, that we'll talk about in a moment. And then a second is the children's system of care. This is where we have a lot of misinformation and confusion, because there was a change. Prior to 2013, we had, everything was covered by DDD. So there was a transfer to the children's system of care then for all the under 21, and they're now served through the Department of Children and Family Services. A little bit like alphabet soup, right? Because we have the department's Children and Family Services, but the actual division is the Children's System of Care. And to further complicate it, we have some other actors. One is your CMO, your care management organization, which sort of acts like your case manager. And then the actual screener is Perform Care. So they're all part of the same system. There's tremendous confusion. So the best way to describe it is that CSAC is the state, right? They actually contract out with Perform Care that acts almost sort of like a way an insurance company would act in terms of looking at your eligibility when you're requesting a service, seeing if you meet criteria, sort of the thumbs up, thumbs down. And then the CMO is sort of your, which is also a not-for-profit paid by contract through the state. So there's a lot of actors, but it is a system that is available, and many people are not aware of it, particularly since DDD transferred. So I just want to let people know that in certain circumstances, there is also a possible state option. And that can be very important for long-term, because we frequently see a smoother transition if an individual is identified as in need of residential prior to adult services than if they're coming into the adult program, or if they are part of the adult system and at a later date are looking for residential. So if you have the circumstance or fact, it's something to think about and explore. Another funding source is the health insurance. Now that tends to be acute stabilization. They're generally short-term, sometimes several months, though not just days or weeks. There are some programs that there is that funding. But as I said, they don't tend to be obviously available for a long-term placement. Okay, next slide, please, Melissa. Now, in school districts, especially since this change has happened, where we've had, it's no longer DDD, but now it's CSAC and Perform Care, that there's been information given to families, particularly through IEP meetings, that this is this resource when an individual has a need for a residential placement, which is a good thing. We want to educate families, but it's also problematic because you can meet criteria in multiple systems. So if you meet criteria for residential placement under CSAC, it doesn't mean you won't also meet it under IDEA. So we know IDEA is the federal and state law that provides for a free, appropriate public education. And through both statutes and case law, it has been established that in some circumstances, it may be appropriate for a school district to place. Now, why that's important is because currently New Jersey only has a contract with one out-of-state provider for under 21. So we will frequently have families that identify programs outside of New Jersey, particularly when they're looking for a campus program or a farmstead, and that's not going to be available under the state-funded program. So we do want to also look possibly at the school district. Next slide, please. Now, this is the seminal case. It's been around for some time, since 1981. And this was a case that is, frequently obviously relied on and cited, and it basically set the precedent that districts, in order to provide the free appropriate education, in some circumstances, it may require a residential placement. So in that case, the school district argued a couple things. One, they said, well, this is too restrictive. Okay. Second is, this is broader than what the IDEA requires. And most importantly, which you frequently have, they'll say, well, what you're talking about is more in the nature of parenting rather than education. And in this case, the family successfully argued that in order for this individual, for this student, to make progress, they had to have the consistency of programming 24/7, and that they were not able to make progress with just services being through a school day. So we do have, as I said, case law that establishes it, and I do throw it out there because it sometimes opens up more options, and the school district cannot force you to go to CSAC or Perform Care. Next slide, please. Okay, now I'm going to jump into just some terminology. We'll try to run through these slides quickly so we can get to some more of the specific program questions on residential options. So in New Jersey, if you're in the DDD system, then the program that's going to fund your residential portion is called the Community Care Program. Again, we got our alphabet soup with some things changing because it used to be called the Community Care Waiver and everyone referred to it as the waiver. So we now have a comprehensive care waiver that has both the supports program, which generally funds your day program or your community-based supports for things like job coaching and the like. And then the second part of the Community Care Waiver is the Community Care Program. So now when you hear waiver, you're really talking about both, and we're looking for the specific program of the Community Care Program. An important part of that you must remember is that in order to be enrolled, you have to be Medicaid eligible. So again, very important to plan so the person doesn't have too many assets in their names. If they're making income, to watch income thresholds and limits on it in order to keep your Medicaid eligibility, though there are some programs through workability that allow people to actually make, you know, more income than they had in the past. But nevertheless, it's important to remember that. If anytime you come ineligible for Medicaid, you risk losing that community care program funding. Okay, next slide. I think also too, what's important to remember is that if you are getting your funding through the community care program, in the old days, everyone just thought about, oh, you got on the waiver, right? And you could now go have your loved one could go into either a supervised apartment or a traditional licensed group home. I know that there's been a lot of aches and pains over the transfer to fee for service, but one of the positive developments has not only been the federal matching funds that New Jersey is now accessing, but also it provides some more flexibility. So when you are, when they get you on the waiting list, you do not have to opt for placement in a group home. And I often have families that will say that you know, well, we didn't go on the wait list yet, or we haven't really pursued it because we're not sure if we're ready for it. If you get placed in the community care program, you can, through a variety of options, access those larger budgets, and they can be quite large. They can, you know, in New Jersey, the highest budgets when you combine the two programs can be as high as over $400,000. Now, those are obviously for the highest tiers, and generally those individuals, obviously, they have those type of numbers because their needs are that significant. But the important thing to remember is that don't think that it's just this is the funding and your only option is going to be to go with a licensed provider, although that's sometimes the parents' choice and it is appropriate. And it's often when family groups are looking at creating new projects, we'll go through, use that model to create their program. I do want to let you know, you could remain in the family's home and have either an agency provide individuals to support the person, or even through the self-directed, do actually self-hires as well. So there's a lot more flexibility. Now, how do you access this large budget, or at least larger budget than you would for just the day supports program? Well, I'm sure you've all heard of the waiting list, which, you know, all states have waiting lists, and New Jersey's is a long list. If you get on now, it's approximately about 10 years until they get to your list, although it has varied because sometimes there are initiatives, sometimes there's more people that are offered it that are no longer in need or have moved or don't elect to do it. So it's not an exact number, but that's a general estimate to use. The way you get on the waiting list now is that when the second parent turns 55, so both parents have to be age 55, you get placed on, and then once a year you'll get a letter that says what number your loved one is. They usually go out in June. I think this year they went out a little bit later in August, and it will tell you what number you are. Now, that's not the only way that people get residential placements. In fact, a large number of people actually do what we call jump the list. And that's where they can't wait. They're either not on the waiting list at all, so we're not even looking at what number they are, or they're on and the circumstances warrant immediate residential placement. Now, in order to do that, it's really a imminent harm standard or homelessness. Now, homelessness might be where perhaps the second parent passed and there's nowhere for the person to go. That could be both an emergency, but also risk of homelessness. We frequently get calls, unfortunately, from siblings, older siblings, where that's happened. And that's how the person ends up accessing the larger budget, and in many circumstances, even a licensed placement. But just remember, you can sometimes jump that list where you are, particularly if someone has intensive medical needs or behavioral needs, or the family circumstance makes it impossible for them to care for their loved one safely. Another thing I want to mention is that this priority versus general waiting list. So that the names have changed many times. So again, you know, it used to be the urgent list, then it was the priority list, then there was the general, you know, the general list. It's it's now, they actually call it the community care program list, right? There is a quote general waiting list. It's utterly useless. You never move off it. You don't really move off it. It's almost like a survey for the state to see if someone who might eventually be interested. You really want to either get on the list when the second parent turned 55 or look to jumping that list, meaning accessing the services now through making a successful argument on why the need is now. Another term that I want to throw out to you, which I'm sure that they'll talk about next week when they talk about housing, is the funding streams. Like, where does the money come from? So because we're now in the federal matching program, it is for the most part a 50-50 federal state match. And the funding streams are two different sources. So they're both through, obviously, federal Department of Human Services. One program is called HCBS, which is the Home and Community-Based Services. The other program is called an ICF, which is an Intermediate Care Facility. In New Jersey, the ICF funding is what we use for our developmental centers and some programs in New Jersey. We don't really have a lot of ICFs. The standard's the same. In order to access it, you have to show that you have a need of that level of care for both of them. It's just the funding stream is different. The rules affecting the models are also different as well. And it varies tremendously in state to state. Some states will look at a program. I do a lot of work nationally. I've been fortunate to visit many states, look at programs, and I've been visiting programs and thinking, oh, this must be home community-based funded, and not, it's an ICF. And same thing, I've been in community programs where thinking this must be HCBS. So it can be a little confusing, but generally in New Jersey, the ICFs have been mostly limited to the funding for developmental centers, but that is not really a federal limitation. And ICF funding is possible, when the state allows it. Next slide, please. Okay, so now I want to talk about New Jersey statewide transition plan. And this is where we're going to clear up lots of confusion. And we're also going to talk about some really great developments. That's probably a rare thing that we hear in presentations involving our population, our loved ones, but there are some really good things that have occurred. So the state STP stands for the Statewide Transition Plan. And where that came out of actually came out of the Affordable Care Act. And it required that each state put forth a plan to CMS, which stands for the Centers for Medicare and Medicaid. That again that's our federal funding source where the matching dollars come from. So when that was passed, essentially CMS said to the states, show us what you're spending your money on. Now, one of the things that they asked for, a big part of it, was what are you doing with those home and community-based services funding? Because the way the law was written for HCBS is that it's not supposed to be used for quote unquote institutional care, like a nursing home or a developmental center. So it was a requirement for states to develop their own plan and then to report back to Medicaid. Originally, this all had to be done, including a survey of their existing programs by the 2019, but it was actually delayed. I have in here 2022, but it was again when after COVID struck, they changed it again. So now it's 2023. Next slide, please. So what services does it address? So it is both day program services and residential services. There has been so much confusion about what you're allowed to use this money for. And most importantly, the way we would translate it for families and providers and not-for-profits and groups that are looking to develop innovative programs is, what are we allowed to do? And if you look at the law itself, the actual regulation, the regulation actually doesn't have a lot of restrictions at all on it. And actually, some of the things that it says you would read and think, well, this is a really good goal. So as long as it's allowing full access to the benefits of community living and offer services in the most integrated settings, that are possible, again, applies to both day and to residential. What ended up happening, though, is that there was a great deal of, first of all, in our view, in the groups that I've worked with on a national level and in many activist communities in New Jersey, we wanted the most flexibility as possible, right? Because why should an individual with the developmental disabilities have less housing choices than any other population? So when the law was first passed, we were okay with it. And then after that, the reg was passed. So again, for the most part, look like programs that offer things like clusters, campuses, farmsteads. They were all going to be fine. But what happened was that CMS issued guidance. And the guidance, though not law, really talks about what the current department is going to allow. Next slide, please. I don't know if I have, right. So again, if we look at the law itself, it's pretty good. It talks about outcome oriented, right? That we need to look at not at the setting itself, but it's not based on the physical location or the size or anything that's prescribed for length of time or things like density clauses and the like. You're really supposed to do individualized planning. And as long as you're giving people the opportunity in order to access the community if they would like to, and to what extent is appropriate in their own person-centered plan, then it would be allowable. Next slide, please. But what ended up happening is that there was, first of all, the guidance that came out, and then also some of these ideas. So they talked about that there are some settings that are going to be presumed to have the qualities of the institution, and they may have to go through an extra level of federal review. So something's, not a lot of controversy about that. If it was located in a building that's also in a publicly or privately operated facility that has inpatient treatment, then they're going to say this is going to be presumed to be institutional, and the state's going to have to come and put forth through a heightened scrutiny process showing the feds that it is eligible for HCBS funding. Also, a setting that's located in a building on the grounds or immediately adjacent to a public institution. I should note, though, that early on in the process, there was actually a program on the grounds in North Dakota on a ICF, on a developmental center, and they actually were approved and were permitted to continue to operate it. So it's not a definite, you can't do these things, but it creates a presumption. Now it's this third bullet point. Any setting that has the effect of isolating for individuals receiving the HCBS from the broader community of individuals not receiving them, that could be a problem. So everyone asks, well, what do you mean by effective isolating? So if I can just back up and talk a little bit about the rules process. So basically the law gets passed and then agencies develop regulations. And then the regulations are promulgated and they're put out. There is a comment period, and when even when the original regs came out, there was a lot of input from a variety of different communities and many groups that weighed in and said, make sure that we're not putting unnecessary restrictions. Again, we want to respect choice. So after you have the regs, though, then what happens is that the agencies start getting questions. Well, what about a farmstead? Well, what about a gated community? Well, what about an apartment building that is specifically designed for a particular population, a particular disability? And then what happens is that the feds actually start to issue guidance. That's where we ran into the problem, because the original guidance that came out went far beyond the law. In fact, many groups argued that it actually was against the spirit of the law, because it said things like they have concerns about farmsteads, and the type of things that they said about farmsteads in that really turned out to not be the case. So they said things like, oh, they tend to be far away in rural communities, and there's no access to the community, to the general public, and there's not interaction. And so through this process of advocacy, many groups came forward, particularly existing programs like that, and not only directly to CMS, but through the help of a number of legislators. And there were a number in New Jersey that helped us on both sides of the aisle, both Senator Booker was very helpful, and also Representative Chris Smith, Congressman Smith as well. So we really had a lot in New Jersey where we're interested in this issue, because families were saying, first of all, and I do remember one legislator saying in one of the meetings with CMS, you show me where there's like hundreds of acres where in New Jersey where people are living on a farm that there's no, connection to the community at all. We just don't have that. You're usually generally at least a mile or even less to a shop right or the community. So the description of it really didn't describe what many of the programs had, and it certainly didn't describe our type of community. Next slide, please. So again, the final rule had some good things. They said no physical characteristics, no person limits. It didn't rule out disability. And they talked a lot about person-centered plans. Now, the important thing to remember, though, that was a baseline, which meant states are always free to be more restrictive. So we do now currently in the United States have a number of states that have continued to be very, very restricted and are not only not allowing the development of models that many individuals thrive in, but also are actually moving to close some existing. And it's really very sad and very heartbreaking for people that have benefited from those models. Next slide, please. Okay, so here's New Jersey's. I swear I'm not going to go through all those bullet points. Well, it will take a long time, but it's there for you. A couple points for this, though, is that New Jersey's STP is a great example of what successful advocacy looks like, because we started out with a horrible statewide transition plan. In fact, when it first came out, I was at a national conference, and there were representatives from all the states, and the speaker that was leading the interactive session actually said, well, let's hear from each state. Oh, I see Lisa Parles is here from New Jersey. Let's have her go first, since New Jersey is the most restricted in the country. It was true, and my heart sank. However, what ended up happening was, because it was so restrictive, and many of you here may have also, remembered that when we first went out to public comment of it. And in fact, when it was first released, it was really handled so poorly. They released it, and essentially the public comment where you would actually come to give your comments was actually supposed to be the very next day. Fortunately, there was a snowstorm, so we actually got another week to try to galvanize and educate, though really it was only a handful of us that came and spoke about it. I remember actually, reading it and just thinking that, this can't be right, and we need to do something about it. We actually, in our firm, started with a number of advocates, a Facebook page that we called Say No to NJ Statewide Transition Plan, and we immediately had thousands of people join. And because of that work and the work of others, and I do want to also give some kudos to Autism New Jersey, who, particularly Suzanne Buchanan, who was really just an incredible force through all of this. And as a result of that, we went through many, many statewide transition plans, and now ours is actually quite good. So next slide, please. So if you remember, just back to the original one, and why I think this was a terrible mistake, actually, on the behalf of people that were looking to limit choice. And I would imagine some are driven by a interest to include, an interest to prevent large institutions. But I would argue that it went in the wrong direction, because what ended up having, when we had something as restricted as this 4 to 6 bed limit for group homes, 25% density limit. So if you went to build a housing complex, only 25% could be available for individuals with disabilities. That was what I think outraged so many people, because what other population would we be comfortable saying to, all right, there's 100 units, you're the 26th African American, you're the 26th Jewish person, you're the 26th female, too many of you, you can't be here. And then, of course, this crazy rule that 75% of the day out in the community for day program, which really made it impossible to administer. I also recognize advocacy work, particularly the medically fragile community, that really came out in full force and said, we're going to literally be changing diapers in food courts or just taking runs to the park to meet it. So the start was terrible, but it really galvanized support. And let's go to the next slide, and you'll see that eventually we ended up with a pretty good version. So now what we have is we have what they call a community integration review. And more importantly, you can actually ask the state to consider the project before the project is built. There was an interim one where it actually said that you had to be up and running in order to get the review, which made it impossible, because how would people invest in building something and then wait to see if it was going to be funded or not? So now in New Jersey, we do have the ability to bring projects to the state. And I would say under the Murphy administration, we've seen quite a few approved, and also to really the message has been, come to us and bring us ideas. Now, they're going to want to look at things like, for instance, if you have a program where the only choice the person has, so say you had like a farm community and you only allowed people to live there and work on the farm, as opposed to giving them the choice at some point in the future. They may say, well, I actually don't want to work on the farm. I want to continue to live here, but I would like to go work outside. They're going to look to make sure that people still have choice. That also they look at, can someone get any kind of services from other providers as well? So it is emerging in terms of what this process looks like, but I'm very, very hopeful. Okay, next slide. Now, there are some questions remaining, but another wonderful news, in March 22nd, 2019, CMS issued new guidance, and they retracted those earlier statements, and they made it very, very clear that there are settings that are not going to be automatically forced to go through this heightened scrutiny process. And that, so for instance, farmsteads, they specifically addressed it and said that there's not this presumption that they are automatically isolated. Now, this is where it got really confusing. So after we get through some of these slides, I'm going to state the rule really clearly to you. But it was never an outright ban, but so many people thought that it was. It really was an extra level review. Now, again, though, if the review couldn't happen until after the program exists, it basically stopped programs throughout the country in its tracks. So it was really problematic. But there was really never an outright ban. And we frequently heard across the country, and in New Jersey, particularly in the early days, we heard from the state, which was, well, it's not us, it's the feds. So again, through the help of a number of New Jersey legislators, we were able to do a number of meetings where connecting New Jersey leadership with CMS, with a number of advocates participating to get clarity. So that new guidance is really very, very helpful, because it says we're not saying we're ruling out farmsteads, clusters, campuses, gated communities, disability specific. Okay, next slide, please. Now, there are obviously still some questions remaining, is that, as time goes on, we have to see what type of programs are going to be approved or going to, come into existence, and how they're going to be reviewed. We don't have written guidelines yet on the community integration review process, and on the co-location on the farmsteads. We've had several statements made that it's not, New Jersey's not close to it, that if you have a project, you should come and bring it to them. But they are going to look at some things, as I said, the example I gave, for instance, if you really are allowing consumer choice, that you can't make it that if someone comes and stays there, that you can demand that all their services must be at that location and only with that provider. So the best way to summarize it is that states can be very restrictive, and some are. For instance, Pennsylvania is very, very restrictive in terms of what they're allowing, and even moving towards closing some really excellent programs. So New Jersey, though, now we have a good STP. There aren't outright bans, and we are seeing more and more projects getting approved, and we have many, many projects in the pipeline. So we're very encouraged by this. Another really positive development is that in New Jersey, we've had some things happen with COA, which is the the Council of Affordable Housing, and also with housing vouchers. So we've seen some enhanced funding in terms of continuing housing vouchers, which is another source that someone would use. I know that Shah is going to address that in length next week, but I did want to just mention it's a positive development. And also in terms of COA, so COA was actually under the previous administration was in many ways just frozen. So there was this money just sitting in municipal housing trust funds that were just not being used because they actually weren't convening COA to actually, you know, be approving the plans. And more importantly, there was a lot of litigation surrounding, you know, what towns' obligations are with respect to affordable housing. Next slide, please. So, so in terms of looking at right now, what's the federal guidance now? States can be stricter. New Jersey's decided not to. And if you are a program that the state decides to put through federal review, they're going to look at some of these things. And as I said, one example is that if it restricts beneficiary choice to receiving services. I also, too, one thing in the new guidance, they talked about how looking at the interaction with the broader community, one thing that they did say was something that would be a positive that would lean towards finding that it is appropriately funded under HCBS was that if the community came and spent time, and there was a while there where we were hearing that, well, that doesn't count, that's reverse integration. And then the feds had said, no, it does count. So, which is really important because we have, you know, some, you know, wonderful programs that are doing things like that. There's one farm community in New Jersey called Oasis that is fabulous, that does, I'm assuming during COVID, they've probably been on hold, but they have done wonderful Sunday brunches and summer breakfasts. And I've been at them, and they're really just a wonderful way for the community to interact with the individual served and for the individual served to learn and practice a number of skills. Next slide, please. So I was just talking about this, the decision of COA. So let me just explain what that is. And I know that next week they'll address that. So when this has been around since the Mount Laurel decision, which is prior to when I was in law school in the 80s. And essentially it was putting a obligation on towns to provide low-income housing. Now, generally speaking, individuals with IDD and with autism are going to qualify as low-income housing recipients, right? Because they're going to be on Medicaid. So I remember once we were starting some of the early advocacy, one of our experts saying that, you know, our individuals are actually, you know, they're poor, and not only in terms of that they often don't have or in competitive employment, and if they do, it's, you know, obviously not enough to sustain them, but also given their service and support needs, their needs are great, so they should absolutely be considered under affordable housing, and they are. So what ended up happening is that there was so much litigation, town by town by town, and COA wasn't meeting, and the monies were just accumulating. So when a developer built a program and they did not put in affordable units, they actually paid into the fund that went into the town's municipal housing trust fund, and we accumulated, I don't know the exact number, I think it was something in, you know, $200 million. I'm sure that Tom Toronto and Shaw can answer that next week, but it was a very large number that was just stuck there for years. We had this decision in 2008, and it really just loosened it. And we are seeing so many towns now not only releasing these funds, but looking for projects. And because there are some projects that have been built and are running successfully and are well kept well, and you know, and really in many cases quite beautiful, some towns are actually seeking partnerships. So in that way, it's a very exciting period for us. Next slide, please. Okay, so this is, oops, I think we just jumped Benjamin's Hope. Okay, thank you. So I've been to many programs in many states. I actually have not been to this program, but I have spent a lot of time with the director because we've done a lot of the national advocacy together. And I've, you know, obviously learned a lot about their program. You can go on the website and take a look at them. And then one of the reasons why I have it up there, because it is a farm community, is because the founders were a New Jersey family. And I'm so happy for them that they built this fabulous community and actually funded most of the building of it through philanthropy. But it always broke my heart that they didn't stay in New Jersey and do it here. So just, take a look at it. It's a great project, but also to that, we're pledging to make sure that there are Benjamin Hope-like projects here in New Jersey. Next slide. Okay, so after the new guidance came out, a number of advocacy groups went back to CMS and asked them, can you please give us a specific wording sentence, literally, to make it very, very clear to the states? And we actually did get this letter from CMS. So it very clearly says, I want to emphasize that the HCBS settings rule does not prohibit individuals from receiving Medicaid HCBS in congregate settings, farmsteads, gated communities, and disability-specific settings. So anytime someone tells you the feds won't allow it, it is just not true, okay? Now, there's a couple places to continue to get information. So let me tell you about these different groups. One is that our Saying No to the New Jersey STP, we actually changed the name of it. When we got a good STP and we didn't have to say no anymore, we changed it to New Jersey Citizens for Choice in DD Housing and Services. So we're on Facebook. Please go and like us. And we use that to post not only New Jersey information, but information on a national level as well. And it's really been a great way to connect people within New Jersey. But as I said, we do post other information. So that's one source. The other is, I would suggest looking at these three national organizations. The first one is the Coalition for Community Choice. This is one of the earliest one. I had mentioned earlier, the Madison House Foundation, that's in Maryland. This was a project that they started a number of years ago that specifically looked at the issue of, we want choice and options in housing for individuals with developmental disabilities. That we do not want them to have less choices. If there can be senior citizen communities, if there can be anyone that wants to can move into an apartment building, not have their head counted, we need the same for us. And they were really one of the very first groups. There's a woman there that heads their housing project called, her name is Desiree Kamika. She is literally one of the most knowledgeable people I've ever encountered. Not only knows the rules, the regs, the cases, but she's been to visit so many programs. It's free to join as a family member, so I suggest joining there. In addition to following their advocacy work, they have a wonderful housing resource on it where you can actually connect with other projects. You can learn about other projects. And if you are working on a project, they have like a project tracker. So it is great. I have to also say thank you to Desiree, because in the very early days of our STP, when we were all just trying to figure it out, Desiree actually came to New Jersey, and we had arranged for her to speak at Rutgers, and I think it played a big role in educating the New Jersey organizations, leaders, families, advocates about that, what was possible, what the rules said and didn't say. So that's a great group. Another one is Together for Choice. So Together for Choice is out of Chicago. It was originally founded by a number of people out of a program in Chicago called Misericordia, a fabulous, fabulous program. They serve individuals with very significant medical needs, medically fragile, and also individuals with IDD, full spectrum, not just individuals with autism, but also individuals with Down syndrome and other developmental disabilities. So that program that has been around, I think, in existence since the 60s. It's headed by Sister Rosemary, who is a tour de force. A wonderful program. If you have the luxury of visiting programs, I suggest looking at it. They do have a variety of settings, but it is a true community. They've done wonderful things in terms of bringing volunteers, including volunteers over from other countries as well. But one of the things that they do have an annual conference. We were actually supposed to be at it next month in Las Vegas, but unfortunately it's not happening this year. But if you join their organization, you can learn about their future conferences. But they really were the seeds for the very targeted advocacy work on a federal level. And they do periodic visits to Washington. I've gone several times with the New Jersey contingency. They actually have a pro bono Washington law firm that has done the lobbying work for free, which was not only doing the research, but putting the packets together, setting up the meetings with legislators. And each time they've done it, New Jersey's participated, and we brought families from the lawmakers area, so that way they were talking directly to constituents. And I think it's made a big difference. So I highly recommend them. If you are an agency, an organization, you can join, and they do monthly calls with updates. One of the things that they're working on right now is, we made these games, we want to keep these games. So they have been throughout this entire election process talking to the campaigns and making sure that we don't go backwards, because it is guidance. So, you know, departments can take different positions. And I do want to get back also to just, you know, the basic premise here. And people ask, I will tell you, sometimes when we would go see legislators and we would say that here's this wonderful idea for a program, or here's this program that exists in, you know, Michigan, and we'd like to replicate it, but we can't. So frequently the reaction would be, well, why? Like, and particularly in New Jersey, I remember in one of the hearings, someone said, we're the garden state, but we can't have farms if we have a disability. So you know, Together for Choice has really done a great job at that, and they have been, you know, writing to both campaigns to make sure that people are aware. Because what happened, I think, is that the pendulum just swings, and it just went from one extreme to the other. So there was a time where the only option, particularly if you were in crisis or had significant needs, that your only option was a developmental center. So you know, and there are, you know, people that felt that there were a number of people that lived in developmental centers that not only didn't need to be there, but didn't even want to be there, but it was the only option. Now, that's not to say, and I will tell you this, you know, people have different views on that. My view is choice and options is good for everyone. And, you know, where a program operates doesn't necessarily mean it's good or bad. You can have quality programming in a large setting. Misericordia has hundreds of people that live on their campus, and it's just fabulous program. You could have a community-based group home that is right there with neighbors around and be more isolating and be of poor quality. So big doesn't necessarily mean bad, and small doesn't necessarily mean good. So we do have to, I think, you know, stay engaged and stay on top of it, because eventually when the states are reporting with their funding, there's going to be a federal process. So we want to stay engaged, and both of these organizations are great organizations. Third one is also the National Council on Severe Autism. This is a new organization, although it's been in the works for many, many years. I'm actually a founding member on the board. And we have really tried to be a voice of the voiceless, because we noticed that a couple things are happening. One is that when families spoke on their loved ones' behalf who couldn't speak because of either severe cognitive deficits or in some cases even no language at all, that we felt they were not being represented. So, you know, and if you looked at who were being appointed to federal appointments, you know, what the representation was on a number of the, you know, committees and the like, individuals with severe autism were not represented adequately. And that was one of our first things, was just to give a forum for families to be able to tell their stories. Because there actually, believe it or not, there's actually been some bullying of families that when they've tried to share their loved one's story have been told, you know, that's not appropriate, you're violating your child's privacy. But if we're not allowed to tell our children's stories, then no one's telling their story. So it's been an amazing success. Also, you know, free to join. When we do post, particularly when we do post on our blogs and we share it on Facebook, we've gotten sometimes as many as 40 or 50,000 hits. So there obviously is a tremendous need out there. And one of the things that we have focused on is this issue of, we need a variety of settings to meet a variety of needs, and we want to make sure that choice is there. Now, again, Big isn't necessarily bad and small isn't always good. So no matter what we build, we have to make sure that we have, you know, quality controls, parental engagement, and a number of factors that I think lead to higher quality programming. One of the hallmarks, I think, always is how are families involved, not just fundraising, but if it is an agency, then families being involved on substantive committees like program development and human rights committees and the like. So, you know, overall, the sort of the point that I want to give you is that the time is good and the opportunity is there and lots of things are brewing. We have families that come to us all the time. I have several groups in my practice that are working on a number of projects, some as young, whose loved ones are as young as 12. So people are thinking about it, and the more national network that goes on, the more people see other programs that are running and thriving that provide alternatives. So again, we sort of went from, you know, only the developmental centers to then, you know, only group homes. And even in some states like Delaware, they don't even like group homes anymore. They just want standalone apartments, which, you know, for some individuals is not a good choice. So I hope you share my optimism. I will tell you that obviously connecting with both the national groups and the New Jersey groups, I didn't put Autism New Jersey on there, but they should be on there because they've really been a leader on this issue of choice and options. But also to tell you that the more networking, the more you learn from each other, because I do frequently have families that come in with an idea, sometimes even something that they've even like had brought to an architect. And we not only want to connect them and guide them, but also to make sure they're thinking about the second piece of it, because it's not just about building. Building is important, and we want to be able to have the funds to do it and be able to build beautiful and innovative things. But don't forget, it's also really important that we're creating really good agencies or expanding existing agencies that are going to be really committed to quality and excellence and family participation. One last thing that I want to just mention, this is, I would say, as a result of COVID that we've seen, is that we did see a very large increase in requests for self-directed programs. So that's not where you're going into a licensed setting, but it's actually an unlicensed setting. It could be even a rental. So the individual actually has a lease, renting a property, and either through self-directed where the family is hiring or they're hiring through an agency. It does give families lots of control. There's lots of plus and minuses to it, but we also though that is right for some families, we do also encourage people to look at the possibility of creating organizations that will survive you, essentially. So I know I ran through a lot, and I probably, I'm hoping, prompted some of your questions. We're going to take a look and see what we have here. I think Melissa's going to take a look. Hi.
It was a great presentation.
Thank you.
Feedback. So I just wanted to, we had a few people who asked some questions. The first one came in early. It said, if you were put on the old DDD wait list for housing prior to perform care, are you still on it, and did they drop you off and it had to be restarted?
Yeah, so you should have your support coordinator check. I mean, people, there was some confusion over whether or not if people were already in the community care program, if they would remain. So people that had already been in the community care program that were under 21, they did actually keep those cases within DDD. But the answer is you need to check. So you need your support coordinator to reach out to DDD, not only to check that you're on it, and get confirmation, but actually get your letter that says what number you are. Because if you're on it, you've got a number. So if you're not getting that letter each year, usually in June, this year it was August, then I'd be concerned and want to check on it.
Great, thank you. The second one was, I was always told that DDD Perform Care is for individuals 21 and over. Is this true, or could we get help from DDD Perform Care for a 12-year-old child?
Okay, so two different systems. And again, it's confusing because it used to all be DDD, and a number of years ago they switched. So currently, over 21 is DDD, okay? Under 21 is Children's System of Care or Perform Care. So the answer is that if we're talking about, and again, I realize when I'm talking about housing versus residential, I'm always joining the two, right? Building the housing, getting the funding to support the rental, the payments, but more importantly, what are the services? And that's where the big dollars come in, right? Supporting the individual running the program. So for under 21, they're through Children's System of Care, who contracts out to Perform Care, which is actually your point of entry. The best way to think about Perform Care is like they act almost like an insurance company. So if you were going to and saying to the state, I'm in crisis, I need a residential program, I have an under 21 child, Perform Care would be who would do the review to give you thumbs up or thumbs down. The same way an insurance company might tell you you can get the MRI or you can't get the MRI. And it does take advocacy. I will tell you, I'm not going to make any friends here. I have found it extremely frustrating to deal with CSOC and Perform Care. I think it's very uneven in terms of how they respond to families. And also too, I never thought I would actually say that DDD is doing a substantially better job than another state entity, but I say it all the time now because part of it is that Perform Care, that system, CSOC, was really created for mental health issues. And as you know, so families often complain that even if they do get a residential placement, there's this constant state of review and this goal of returning the child home to the family. Look, we all want that. It is, I know my son went into residential at 19. It was the most difficult, painful decision that we ever made as a family. It also was the most important and needed decision we ever made. So all families want that, but if the system's constantly saying reunite, 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 when the person went because you couldn't provide the supports, or you might have had where a sibling was endangered because of behavior, it's really unfair to constantly be saying that to parents because it's a little different than mental health where you might just have some stabilization and then go home. So I will tell you another resource, an excellent advocate, Paul Aronson, is just wonderful. If you haven't seen his new report, he just came out with one where he talks a lot about this, that we don't have enough residential, it's too complicated, it's uneven on who gets it, and we need more options. So under 21, you're gonna be in the Perform Care, but also don't forget your school district as well. School districts are not only responsible, if someone has intensive needs, they may be responsible for services beyond the school day, not only home, but possibly even a placement. I hope that answered it.
Thank you. Another question is, I just got a letter saying we were 200 on the list. What if we are not ready when our number comes up?
Okay, so great question. And I meant to cover that and I didn't. So I'm glad someone asked it. So they're not going to reach you. And so I've had families actually say, I don't want to get on the list because then they're going to come and take my child. I tell them, well, if only you knew we're banging on the doors asking for help in emergencies. So you don't have to, under the fee for service, you do not have to place your child. You can get on the community care waiver, get that bigger budget, and you can support your child in your home. So you can either through self-hire, where through a PPL, a fiscal intermediary, that's a whole nother presentation. Maybe we'll do it for Spectrum in a couple months from now, but there are other systems, or you can even have an agency provide people in your home. They can. Am I back? I was muted there for a moment. Okay. So you don't have to worry that if your number comes up, you don't have to say, show me a group home. You can do an unlicensed setting, a house sharing. I know next week they're going to talk about that model, but you can also keep your loved one at home and use it to just purchase staff that will come and support your loved one in your home or in the community. It will broaden your budget, not limit your choices.
Thank you. That's great.
Sure.
Okay, there was a time when special needs units got extra credit for towns in meetings their quotas. Is that still the case? Awesome.
Yeah.
Okay.
You know what? I actually don't know. I know that it was double so the COA credit says that, the municipal housing trust funds would go into a fund. And then when the developer would come and say, or a not-for-profit, we want to build something, they could use those funds. The towns get they're set numbers. So they may say, like, you still are behind by 500 units. There was a period of time where they actually did get double credit for individuals with IDD. I don't know if that's still in effect. I'm sure next week's speakers can answer that for you. So I'm not sure. It was true at one point, but I don't know if it continues today.
And the second part, also, does a group home count as just one unit, or does each resident count individually? For example, 4-bedroom group home would count as 4.
Yeah, it's per unit is going to be per participant. Yes, that's correct. For a COA credit.
So we need our children's DDD benefits to be transferable to other states. You can't lose the benefit. Oh, it's a comment. Excuse me. I'm going to move on to that.
Okay, but I will say that person is correct, and that is a frequent question. People will ask, if my child is placed and then we retire and we move, what happens? Well, if you leave your child in the state, you can move once they've been here and placed. I usually recommend wait a year, but they don't translate. And I totally agree. It's sort of crazy that if you move, you have to start all over again. So if you take your child, your waiver doesn't translate. It is a flaw in the system.
Great. Another question is Florida a restricted state? Just wondered if a family, including their adult child with autism, moved to Florida, if they were similar housing options like New Jersey.
Okay, so Florida is sort of an interesting state in that they have actually done some innovative program. In fact, one project I suggest you look at is the Arc of Jacksonville. They've built a wonderful, wonderful intentional community. It's for residents with a little bit more independent living skills, but they do have some supports. They actually got state funding towards their building to actually build. So Florida does support that model. So in terms of the building, Florida has shown some innovation and support for these type of models. However, it's not just about the building, it's also about the budget. So just remember, when you move, you may be starting all over again in terms of now you have to get on the waiver or get on the list or prove that you need it. So if it's an individual that has, 24/7 needs, moving state to state, I always recommend find my equivalent in that state, get yourself, educated on what you would need to do, because, so yes, Florida is supporting some innovative models, but in terms of the funding stream, it's not going to translate. And Florida, if you compare Florida, the type of dollars that they put towards the actual running of programs is substantially less than New Jersey. New Jersey actually is a pretty robust funding stream once you get access to it.
That's always key. So we have one from one of our board members. As a parent and vice president of the Spectrum360 board, I want to thank Ms. Parles for her heroic efforts on behalf of our loved ones. We appreciate how crazy busy you are, and wants to know, is your firm taking new clients from families seeking to learn more about residential services?
Yes, we are. First of all, we always try to do it in the way of webinars, so people don't have to pay to learn this. And I think we actually even have one on our website as well, too, a recent one that we did, so you can access there. So yes, we are. Now, one of the things that we try to do is that we have to separate the individual, because sometimes you do need an individual consult, because we got to figure out a strategy to get you that budget, because it's not just a matter of getting on the waiver, but let's make sure you're getting the proper NJCAT score, because it's tremendous. It could be 40,000 to over 400,000. So the stakes are pretty high, and you may need some advocacy in order to get into that community care program. But on the issue of bringing people together, we do webinars all the time. We're actually next month doing one for, a group of parents that are in a school with younger children that want to start preparing. And we have several groups in the practice that we have represented for certain pieces of it. And We often do, though, refer, once you get to the point where you're actually looking at licensing, there are other places that we refer you that I think are better versed in those details.
Okay, great.
So
Well,
the answer is yes.
Yeah, I'll share your contact information too when we send this webinar recording out so that people can, talk to you and consult with you.
And since that lovely comment came from a board member, I'd like to just take a moment to just say thank you to Spectrum again. I mean, it's such a wonderful, wonderful program, board, not only led by Bruce, but a really active board. And, at a time when it was scary to jump into adult services, that they were really willing to do it when we were just switching to fee for service and we couldn't get any answers at all. And now, honestly, with COVID, it being really a struggle, and they keep their commitment to it. So just want to acknowledge the great work that you guys do.
Thank you. I know many, including Kim Rushmore, will appreciate that comment. Just want to confirm, before you can get on the wait list, a parent has to be the age 55 and over.
That's right. Both parents have to be 55. So we say when the second parent turns 55, you get placed on the waiting list. Now, we have had cases where people have been in DDD for quite some time and no one ever told them that. So we have sometimes been able to go back and argue that it should be retroactive to the 55th birthday because they've been in the system, they had a case manager. So you might be able to, be able to get on with a date going back further. But it is, currently now that is at the second parent. So both have to be 55.
Great. Who should I contact for assistance to start a home for my adult child?
Okay, so I'm assuming the person's talking about actually starting a project.
Mm-hmm.
So I would say, a couple different sources for ideas. I'm going to turn to those national organizations because they're just a great source of what's out there. And as I said, the Madison House, the Coalition for Community Choice, they actually have project trackers, which will allow you to not only put your project up there, but to connect with other projects that are in development or projects that exist. So that's a good resource if you're looking for ideas. In terms of your child's funding source, you may need an individual consult with the lawyer to make sure that you're going to have the budget that you need. And then in terms of actually creating a program, I will tell you that there is a new service available in New Jersey for people that don't want to go the licensed provider route, the traditional group home, but want to actually do something where it's perhaps a rental home and they are actually hiring the employees. Very challenging to do, but I've seen some people do it successfully, and that's support brokerage. So we used to have DDD case managers. Then we got rid of that, and we got support coordinators that are supposed to act like your case managers. Support brokers are actually people that can help you put a program together. And I'm going to give kudos to one in particular. Jennifer Brown is excellent. Her name of her organization is EIROS, E-I-R-O-S. And they can actually help you, tell you this is how you do it. And if you actually starting a project where you're doing self-directed, she can even help you recruit staff and hire staff. So that's a new service that did not exist until I think about a year ago. So that's a good resource as well.
Great. Is Perform Care only for low-income families?
No, it's not an income tax. Now there could be, if you get a residential placement, there can be, they do look at parental income for a parental contribution. And there are some circumstances where they make the child into a family of one and you get placed on Medicaid, but your entrance into the system is not related to parental income. It's related to service needs. And I should also mention too, Perform Care has other services as well. They have in-home counseling, they have ABA therapy in the home, they have respite. The problem is the wait list, it's not an entitlement, so they can make you wait and wait and wait. It's somewhat frustrating. The application process is really onerous too. That I would suggest your family support councils. So in New Jersey, the state's divided up into regions through the Council on Developmental Disabilities. And, I can send that to you, Melissa, so you could share that with people on your website. So I think there's 11 councils. So sometimes, a couple different counties within it. And those family support councils are really great resources on terms of how you enter the system and if you hit a snag. And there is actually a collaboration committee that meets periodically with Perform Care and CSAC to talk about problems parents are encountering. And they've done a lot of really excellent work in trying to streamline the application process for families. It's still onerous, but it's not onerous, painful, and excruciating. It's just onerous and painful. Okay.
Okay, best of 2 out of 3 is not bad.
Right.
Okay, the next question is there any statewide list of developments or developments the same that are being built that might be looking for residents? So
Yeah,
that might
so there's not for ones that don't exist. I mean, there are some developers that could be a resource. For instance, I know that Penrose does a lot of developments in New Jersey. They actually, the newest one I think is in Fort Lee. They have another one actually coming to Glassboro, which is sort of an interesting project. It's going to be a combination of senior housing and IDD. So that's, you know, one resource. I'm sure that Shah and Tom Toronto are going to talk more about this. So there's not a list before it exists. But again, there's lots of different networking that's going on that families are working on projects. And sometimes when there's a new project, it will be announced. So I actually, there's one that I think will probably be sometime in November, December, for instance, that will, be doing an announcement, and I'm sure it will be out on social media, because when those projects open, it's usually what I've seen happen. It's a core of families that have worked on the project, but it's not every spot. So at some point they're going to enter into the screening phase, and they're going to be looking for families as well. But unfortunately, the only list that they have available are once you actually are licensed, then the support coordinator can access existing programs. But that's a good idea. We should use the New Jersey Citizens for Choice Facebook page more frequently for that. And I invite anyone that has projects that wants to connect to other people, post it there, because lots of people visit it. We get thousands of people sometimes when we post things. That would be a good place for people to find each other and network.
Okay, I'll make sure I put that Facebook page.
Yeah, I think it's also on the last slide.
That'll be great. I'll make sure everyone gets a link to that. Yeah. In addition to the information that will be shared over the next several weeks, what is a good way to identify, learn about the various projects underway in New Jersey?
Yeah, so as I just said, I think, like that Facebook page, and you're going to definitely hear more about, developers that are developing things. And honestly, I will tell you that a lot of it is just happening now. I mean, it really is. I almost feel like, particularly in the autism community, it's like we have had different stages, right? So how you want to look back, oh my God, look back to 1993 when my son was diagnosed, where, there were no ABA programs, so you had to go to a different state. Then there were no schools, then there became schools, and the schools began to do adult programs. Like, I firmly believe that the landscape is just going to continue to improve, because those same wave of parents that ran the home program, started the schools, are now looking at adult day, are now starting to think about residential as well. Mm-hmm. So we're nowhere near where we need to be, but I think there's hope on the horizon.
Good message, good positive message in this time. The one is, my child is 26. I have not applied for housing. I will be 55 next year. Should I apply now?
Okay, so you should definitely have your support coordinator when the second parent turns 55. Make sure that you're put on the waiting list. Make sure that it is the priority urgent list for the community care program, not the general list. I don't even know what the general list. I used to say to parents, if you're on the general list, just put your child's name on a Post-it and put it up in the wall McDonald's, because it's about the equivalent, because no one is going to notice there, and it's meaningless at the state level. So you want to make sure that it's on the list for the community care program, and you get written confirmation you've been placed on the list, and then every year you should get notification of what number you're on the list. Of course, remembering that there are lots of scenarios where people can't wait till their number comes up. Now, it often takes a lot of advocacy to successfully argue that, but we have seen it done, and we spend a lot of time doing that for families.
So, question about the list. So, getting put on the list, you have to go through your support specialist when you turn 55. Is that how you get on the list?
Yes, your support coordinator puts the request in.
Okay, and then going back to the list too, is it not correct that even if your number for CCP comes up, you still have to show an emergency need or eligibility? Is that true?
You have to show a level of care. So, you know, if it was someone that, you know, was living on their own and then, you know, in college, you know, there've been some circumstances where the person, they've indicated that they don't have a level of care for it. So there still is assessment, but it's not a very high burden the same way as when you're trying to jump the list and argue true emergency. So we have people that have been able to access it that, you know, no one uses the word anymore because the DSM won't let you, but people with Asperger's that have successfully accessed it. But you do have to still show some need. I mean, if someone is literally living with no supports and everything successfully, you know, you may have to do some advocacy to show that they need supports.
We do have a person who mentioned that their son keeps being moved down the list instead of up. So last year he was 880 and now he's 1100. Is there a reason or that would be happening?
I've actually never encountered that. They should ask their support coordinator to find out from DDD what happens.
Okay.
I haven't seen that.
Okay.
That's, I mean, usually people are not only moving up, but, you know, they will frequently get to people on the list and people have moved to another state or, you know, other circumstances. So I haven't seen anyone's number change in that direction. That's concerning to me. They should have their support coordinator look into that.
Thank you. We're getting up to the end of the time. It's about 8:25. So I think we'll have about one more question. I just want to remind the audience that we will have Lisa available for further questions on October 6th, along with other speakers. So it could be a nice combination of getting some answers as a collective group. So I was going to end on this. If parents are 55 plus, but their child is under 21 and not DDD eligible, can they still get on the CCP priority wait list?
No, you can't get on the list until you're in the DDD system now. So for long-term adult services, CCP, you can't get on until you're in the system. And they won't let you in the system until you're 21.
Okay, great. Okay, so let me just pull up the information again from...
One other point that I don't think I made. Two things. One is that there was a case recently out of Chicago in March that was, you know, really terrific. A federal decision that actually struck down on federal rules that density restrictions, saying like there's too many of you. This was a group home that was being forced to close because they said they were too close to another existing group home. And the federal court ruled that it was a violation of fair housing, the ADA, and the Rehabilitation Act. Thankfully, we haven't had to argue that in New Jersey because they have allowed that. But it was great news to hear a federal court finally rule on that. And then the second point too is that we have through COVID had a lot of parents talk to us about these alternative models of self-direction because the visitation restrictions were just heartbreaking, onerous, just too difficult for individuals. So because we now have this support broker position, I think it's a little bit more doable, but I do throw that out there. And maybe when we get together next time, if people have more questions about that, I can talk about that further. But I have had families move from traditional funded licensed group homes into these more self-directed models.
Great. Well, Lisa, I'm going to pass this over to Bruce. I'll make sure these questions get to you and we share them again for the rest of the audience that we didn't get to on October 6th. But Bruce, you want to make any final comments before we sign off here?
Lisa, I want to express my heartfelt appreciation for your excellent presentation, your knowledge, your passion, and your optimism. And I want to thank everyone that participated. I want to thank Melissa and Brenda for helping put this together. And we encourage you to join our other sessions. And we're really hoping this is really, as Lisa mentioned, that this is the time that I think the needs of individuals with autism are getting a lot of attention. And I think with what's happening with fair housing, there's a lot of exciting opportunities in the future. And I just hope, Spectrum360 will be committed to helping provide you with more workshops and more resources and encourage families to get together. All right, thank you.
Thank you, Lisa.
It's my pleasure.
Thank you, audience. Everyone have a wonderful evening, and we'll see you next week, 7 p.m., September 22nd. Thank you again.
Thank you. Have a good night.